There are around 7,000 to 8,000 disorders which are commonly called as rare diseases. So some of these diseases which I have placed here is like you have, which are very commonly present across the globe, is this primary immunodeficiency disorders, hemophilia A, Fragile X syndrome, Pompe disease, Fabry's disease, cystic fibrosis, neurofibromatosis, osteogenesis imperfecta. So these are all some of the common diseases, common rare diseases, which mostly often it is present. And if you, as we saw earlier, 50 to 70% are amongst children, and 80% of all these rare diseases are genetic in origin. So that could be possibly one of the reason that we can say we see that is more commonly among children, present more commonly among children, because it's genetic in origin. Now, what are some of the common characteristics? We should first understand the disease. And there are common characteristics and there is rarity also. See, you can see, I say it is rare, and then we also say that it is present in so much percent of the population. And we say it is genetic, and then we say it's a chronic disease. So there is a mix of so many things in this particular thing. So what are the common characteristics of this rare disease? So rare diseases are very severe, okay, to chronic and often degenerative and life-threatening diseases. So amongst those 8,000 type of rare diseases, most of them are severe, chronic, and degenerative in nature. The 50% of them are in childhood, you can see in children, or the onset would be in children. And the quality, this affects the quality of life of the patients. So when any disease which affects from childhood, you can imagine the quality of life of that particular child, how it would be. So there is totally, their quality of life will be affected. Okay. So now the rare diseases, one of the common feature is it is very difficult to manage because it is hereditary or genetic in nature. Okay. And not everybody has, few families encounter these, and finding them is very difficult. Identifying them is difficult, and identifying the disease, diagnosis of the disease is difficult, and finding a right treatment is difficult. Even if right treatment is there, diagnosing on time is difficult. So most often what happens is, because it is not, because it's a rare disease, generally as a physicians, we all ignore the diseases. And even in medical schools, these diseases are not taught in very common. So it is said, when our brain doesn't know, our eyes would not see the symptoms or the signs of it. So we will not be able to diagnose it. So in that way, we miss on the disease. So even if we identify, it takes years to, the patients are usually struggling for many years. They may go to multiple doctors, and then somebody will identify this is one of the rare diseases. Or it may take, sometimes it may take up to 7, the statistics says, so it takes up to 7 years also to identify that this is a disease, and which is very rare disease. And amongst all these things, most of them are not curable. Only 5 to 6% has treatment for disease. And most of the treatment what is present also, they are not very effective. Okay. So what they try to do is, they at least try to improve their quality of life with various other supportive therapies or treatment, whatever they are trying to do. And this is very painful. Painful, I would say, apart from the physical painful, even psychological, it is very painful. There's a lot of burden. So the patients who are suffering from this rare disease, not only they are suffering, even their parents are suffering, their family members are having, and literally they may not have any support, because even if somebody wants to understand what is the disease, they don't know, because they don't know that it's a disease. They would not even show some kind of a sympathy or empathy to the particular person. So psychological effects are also very high because of this particular rare diseases. Now, what are some of the challenges when we come to the rare disease? The most important and the first challenge is uh, the the treatment is very less. Out of the 7,000 to 8,000 disease, what we have currently at present, less than 5% of these diseases have some kind of a treatment. We could call it as an effective treatment, some kind of a benefit to the patient. And the rest of the 95, it has no, we do not know what to do. So there is no treatment for it. And half of these are left undiagnosed because, as I said, we do not know, we do not have the knowledge about this disease. Most of them, why I'm telling we is because most of us do not have knowledge of this disease. So we do not diagnose it. So this is some of the challenge what we see. Now, even if they get the diagnosis, it gets delayed. As I said, because we don't see it keeps on multiple physicians they go to, they don't get treatment, and then finally somebody says, then they think about it could be a rare disease, and then they look at it and then they go for diagnosis. So even if they diagnose, there is a problem of incorrect treatment, incorrect diagnosis, incorrect treatment, care they were not able to provide, and even social acceptance is also a problem with these diseases. Think from the challenge from the individual perspective. See, it takes such a long time for the diagnosis. Imagine the kind of pain, the kind of psychological difficulty, or maybe the depression these people would go into. So that's also a big challenge in identifying the disease itself and going for the treatment. Now, the other challenges, so give you an example, as I already told you, there is no treatment. To give an example, in United States, it takes 8 physicians. So the generally on an average, the rare disease patient visits 8 physicians, and then 2 to 3 misdiagnoses. Only after all these things, they are able to receive or diagnose that this is a rare disease. Okay, so it takes, by the time they go do all these things or go to a genetic diagnosis, because most of them are genetic disorder, it takes 5 to 6 years. Generally, we don't suspect anything as rare. It is told to us that you should always look at common diseases first and then go for rare diseases or uncommon diseases or something which is not prevalent in that particular region. So that's why it is also again depending on the region or the geography what it is there. In Europe, 25% of these rare disease patients, they had to visit 5 years or 30 years, 5 years to 30 years from the disease onset, so that then they get the genetic diagnosis. So till then, they are not able to identify what it is. The other challenge is, one is identifying, because we do not know, we go on spending a lot of money. We spend a lot of money, and it is not only it's a private patient or a government patient, whoever it is, they have to spend a lot. And there is unnecessary medical follow-up. We keep beating around the bush and then trying to do all kinds of tests which are not necessary. So we first take a conventional approach, then we go for these things. So it becomes very expensive. And as I told you, whatever treatment they have taken, it has not helped them. It is ineffective. And we even sometimes induce other diseases because of all these things. Okay. So there is a cost is very high to this, because it is they have to go for the tests, and tests are also very expensive, and these genetic screening is not easily available. Very few diagnostics do these kind of tests, and it's very expensive as well. The other challenge what we generally face is, sometimes we call rare diseases as orphans disease. Why it is orphan diseases? Nobody takes the responsibility of this disease because they don't, it doesn't belong to them. Whether surgeon will not take, physicians will not take. Okay. And uh, not only that disease is orphan, nobody wants to take the responsibility or they do not know. Even we call the drugs, they're orphan drugs for these rare diseases. Why? Because there are very few drugs which are available, because the pharmaceutical companies would not manufacture those disease drugs which are not moving fast. See, for them, if some drug which multiple people, thousands of people are procuring or purchasing, that is profitable for them. If there are rarely somebody is using, so they don't want to manufacture. So that is why it's called as orphan disease and orphan drug. So there is even in US now they have an drugs act based on which they're producing now. So the prices are extremely high, and rarely you will find any pharmaceutical manufacturer working on it. So that's another big challenge, what we will say, even if we identify this. Now, from a public health point of view, we look at it. So the government or whoever is handling, they have to look at the balance between the common disease and the rare disease. Okay, why? Because we have to focus on those diseases where the morbidity and mortality is very high. So we have, because especially the resource constraint settings, whether it is emerging economy or the low income countries, middle income countries or something. So they, even not only that, even the high income countries have to look into these balance, whether to focus on this or to focus on the population which the morbidity is very high. All these things, the challenges are there. Now, why the focus has come? If you notice, it is the thanks to COVID which has brought the focus of rare diseases, and people have started working on this.